guys. Alright, so we're going to do the medication portion this time of the labs. This one is the one I particularly have heard several people have struggled with because of the time frame, and there's like a lot of stuff you have to document, and yeah, so I've been trying to practice this one more. I just drew a blank. So I'll walk in and they will say, "Hello, my name is George. This is the medication administration station. You are expected to adhere to the professional behavior essential competency during this station. The patient's medical record is here. The medications and supplies are here, and I will serve as the patient for identification and administration of oral medications. The CE will be wearing the band. You'll give her the oral meds and check the bracelet for on her. So the mannequin that will serve as the patient for the remainder of the medications. Tell me when you are ready for me to review the MAR with your documentation of the pertinent data and clinical decision. Tell me when you are ready for me to verify the medication you've prepared, and tell me when you've completed the remaining clinical elements. You have 30 minutes to complete the station." I checked with Excelsior, they said we have 35, so we have 35 minutes to complete the station. Okay, so I'm going to start my time. Get my stuff here. So my patient's name is Kermit the Frog. So Kermit was admitted for urinary tract infection, and he has some dizziness and nausea and unexplained blood loss. Has a history of congestive heart failure, type 2 diabetes, celiac, and GERD. And I don't feel like any of this information is relevant at this moment. So we go to my MAR. And I'm going to give Lantus, and our hold of his blood sugar is less than 150. Amoxicillin by mouth 2 times daily. Lasix 40 milligrams IV push over 1 minute, flush with 0.9% normal saline before and after flush. Omeprazole 20 milligrams by mouth daily. Vitamin K 5 milligrams by mouth. Hold for INR less than 1.2. Okay, well, Kermit, I'm going to make sure that this is for you. So I'm going to ask the CE. I'm going to identify the CE first. So Kermit the Frog, Kermit the Frog. Birth date 1/21/66, birth date 1/21/66. MRN 123456, 123456. Okay, so this is correct MAR for the correct patient. So now I'm going to fill out the information. So the Lantus I'm not giving unless his blood sugar is over 150. So you get like labs. So his glucose was 165. So I'm going to write that in the lab section here. And what was the other one? Vitamin K, I'm holding if the INR is less than 1.2. And INR is 0.5. So write that in here. And since it is less than 1.2, I'm going to hold. Okay, well there's that information. Alright, so what is Lantus? Lantus, patient has history of type 2 diabetes mellitus and is a diabetic medication. Amoxicillin is a antibiotic. Patient was admitted, I don't know if I have to do all this, admitted for UTI. And you know what, because it doesn't ask for it, but I'm giving an antibiotic, so I'm going to look and see what his white blood cell count was to see, and it was 15,000. So I think just to cover my hiney, I will put white blood cells 15,000. Okay, Lasix is a diuretic, and he has a history of congestive heart failure. Omeprazole is a proton pump inhibitor, and he has a history of GERD. Vitamin K. That's for clotting. What do I do with it? This is what I'm supposed to have in my book. I want to say for clotting. And I know he's got a history of celiacs. Okay. So I imagine I would give this to the instructor, and she would look and either agree or disagree. Have maybe, are you sure? Sure. I'm sure as I'm gonna be at this point. All right. So then I put my name, my number. Alright, so I'm giving Lantus 4 units. I'm going to give amoxicillin 500 milligrams. I'm going to give Lasix 40 milligrams. Omeprazole 20 milligrams. And I'm not giving the vitamin K, I'm holding that. Alright, so I continue with my paperwork. I have these labs. I have like the druggy things, the labels, so I can go off of that. So let's go with the amoxicillin. I need to give 500 milligrams, and this comes in 250 milligram tablets. So times 1 tablet equals my trusty calculator. We're going to get 2 tablets. So for amoxicillin, I'm going to put 2 tablets. The Lantus. We're going to get 4 units, which would equal to be, because it's 4 units and they have 100 units per 1 ml. I don't know if this matters or not. Divided by 100. So it equals 0.04 mLs, but I'm giving 4 units, so because that's what the order says. Prilosec, it comes in 20 milligram tablets. So I don't know if they want me to do this either. Omeprazole, 20 milligrams over 20 milligram tablets equals 1 tab. So I'm going to give 1 tablet, and then the Lasix, I need to give 40 milligrams, and it comes in 100 milligrams per 10 ml. So I'm going to do 40 milligrams divided by the 100 milligrams we have on hand times 10. So I'm going to give 4 ml. And then I will show her this. I'll show you this. Okay. She just will say, "You may proceed." So now I have to gather up all my stuff. So I'm going to clean my hands. And gather out the right syringes. So I need to have 2 flushes. Now when I went to the workshop, they gave me these for flushes. I would love the fact that these are going to be on hand. But I'm not banking on it, so. I need I'm giving 2 oral meds. And my insulin. And then I need Lasix. We'll say this is the Lasix. That's my flush water. I normally have like one of those little stopper things on them, so I'm just gonna put this in there. Okay. Whew. And some gloves. Never had too many gloves. Alright. So first I am going to look for Lasix 40 milligrams. Nope, not doing that one. Getting confused. So, gather not my supplies. Alright, clean my hands. See, I'm already getting off track. Put these out. I need so 1, 2, 3, 4, 5, 6. That's for the push. And then 1, 2, 3 for the insulin. I need an insulin syringe. Got my insulin syringe. Gotta pick the right syringes. Okay, so first I'm gonna grab my omeprazole. So omeprazole, 20 milligrams, 1 tablet. I'm going to put that on my cup so you can see it. And then I'm also going to grab my amoxicillin, 500 milligrams. There's going to be 2 tablets in this one. Alright. I'm going to rummage through here. And I'm going to find, ignore the writing, it's going to say amoxicillin, 500 milligram, 250 milligrams, so I'm going to need 2 tablets. That's my 1, 2. And then I shift through this again, and it says omeprazole. Omeprazole, 20 milligram tablet, so I just need 1 tablet. So I just need 1 tablet. Is 1 too many? So my oral medications are done. So I will show the CE that I got 2 tablets of the amoxicillin. Probably should have done that before I grabbed the omeprazole, but now I'll show her that I have 1 tablet of the omeprazole. Next, I'm going to draw up 4 units of insulin, so I'm going to write Lantus, 4 units, 0.4 ml. Is that handy? I'm drawing a blank. Oh, whether or not to roll this or not, so I'm going to roll it. Let's rip this open, clean it off. My syringe. And not touching the plunger. Stick that in there. Can't get it without. Ah! Don't do that now. Recap. And then I would show, I don't know if you can see it. I can't get show you. It's not going to be too clear. So I got it at the 4. Label that one. Put that aside. And put those 2 alcohols next. So where am I at? I'm at the Lasix, so make sure Lasix 40 milligrams, 40 milligrams. Put that stop in there for a second. Alright, so we're going to clean that off. Make sure to grab a 6 ml syringe because I need 4 mLs. So I'm going to push it to 4. Twist it on here. Stick it in there. Turn it upside down so I can see it. Pull it up to 4. Leaking everywhere. That's what you get when you reuse bottles. Alright, so 4 mLs. Still agree or disagree. So that's Lasix, 40 milligrams, and 4 mLs. Alright, so I got my medications drawn up. I'm just going to draw up my flushes real quick. Clean that one off. Those are all garbage. We wanted 3 mLs. So squish the air in, flip it over. So 3 mLs. I should probably get this. So 0.9% sodium chloride, 3 mLs, and I'm putting a B for before. Now I'm going to do this one. 0.9% sodium chloride, 3 mLs, A for after. So that's before the flush and after the flush. Right there. Clean. Squish the air in, flip it around, suck up the fluid. See how my fingers are? It's like pinkies out. Show the CE. Seen a bubble? See, now once I got the air out of there, it's not correct. I'm going to grab, clean again. There it goes. Alright. So now I'll show 3 mLs. So those are my flushes. Alright, so these already. and my pills. So now I'm going to go identify my CE again. Actually, I'm going to clean my hands again. Now I'm going to go identify the CE, and I'm going to be like Kermit the Frog, Kermit the Frog. Birth date 1/21/66, birth date 1/21/66. MRN 123456, MRN 123456. Okay, so I have some medications to give you. I'm going to start with your IVs. I'm going to clean my hands again. We're going to put on some gloves. I'm going to check your IV site real quick. So first I'm going to check your IV site, and I'm going to say there is no redness or edema. Okay. And then, so I have your Lasix here, but first I'm going to, probably wouldn't work out very well. Let's try that again. So I have your Lasix here, but first I'm going to flush, do the B for before. Clean that off, put that away. Alright, we're just gonna flush. Everything's going good. It's patent. Throw that in my sharps container. Alright, next I have the Lasix. I'm going to clean the site. And I have to give this over a minute. So we're going to I'm halfway there, and I'm at 2 milliliters left to go, so almost there. That is all done. So then the sharps container. And then we're going to flush it one last time. Flushing. And sharps container, and again I'm going to check, and I'm going to see that there is no redness or edema. Take off my gloves. Clean my hands. Alright, next I have the insulin to give. A new pair of gloves. I'm going to notice that their belly is not bruised or anything right now. There's no redness. So I have two. So one is to clean with and one is to after the injection. So clean with one. Take it in my hand. And I'm going to grab the belly and go in at 90-degree angle. Squish. And then take that out and put that there. Cap will go up. I'm not going to because I'm going to reuse that. And then I will say there is no bruising or bleeding or redness. This off. Clean my hands again. Lots of hand cleaning. Alright, now for the CE, I'm going to give her these. So the first one is omeprazole. There's one tablet, 20 milligrams. This is for her acid reflux. So I get that. One at a time. Next one is amoxicillin. There's 2 tablets. You have to take them one at a time. This is for antibiotic for her urinary tract infection. like the flavor of amoxicillin. Alright, wash my hands again. Alright, so I clean up my mess a little bit. And then I'm going to chart the rest. So the Lantus was given. We gave it in her lower belly. Right lower quadrant. So I'm going to put injection site was K. Amoxicillin. So we gave that, so we sign. Amoxicillin we gave. That's good. Lasix we gave. So the IV site was no redness or edema. And then after the IV injection site, there was no redness or edema. Omeprazole we gave. And then vitamin K we held. Now we sign. And my initials. Excelsior College student nurse. And then my clinical notes. So held vitamin K due to INR 0.5. No bruising or bleeding noted to, where did I go with that K? Right lower quadrant to right lower abdomen after Lantus injection. Patient tolerated all oral medications, no abbreviation medications, denies nausea. I'm gonna say that's it. So if I stop, there's 7 minutes left. So that was awesome. That was awesome. Yeah. Be good as long as I don't get a drip in there. Alright. Medications. Document on the MAR, correct? Identification for the use of the medication. Did that. Pertinent data, that's the lab values and stuff. So sign the MAR, yes. Initial where I gave, yes. I guess I need to initial the not given section as well. Assessment data to support reasons for not giving medication. And condition of site for IV. Okay, I think I did all that. Okay, let's check out my fake one. Sub-Q injection site without redness or swelling. Patient denied discomfort. Vitamin K held due to INR of 0.5. I did good. I did good. Let me know your thoughts.